Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Alice Payne Merritt, the Deputy Director and COVID Team Leader for the Center for Communication Programs at Johns Hopkins. The center, which is known by its initials CCP, has worked for more than 3 decades supporting all kinds of public health communications in more than 60 countries. Topics include tobacco control, seatbelt wearing, HIV prevention, and everything in between. Today, CCP is working on COVID. This podcast includes audio clips of messages about COVID from across the globe. Let's listen. Thank you so much for joining me today to talk about COVID-19 messaging from around the world. I think it would help if you could start by introducing the Center for Communication Programs at Johns Hopkins.
Hi, Josh. The Center for Communication Programs at the School of Public Health. We have been focusing on improving health and well-being around the world for about 35 or more years. And we focus on positive behavior change using behavioral science theories and evidence to reach people and motivate them to be able to protect their health.
It's an amazing amount and body of work that you've done. How many countries has CCP worked in so far?
Oh my goodness. I think over these many years, I would say at least 60. And we've calculated we've reached well over 1 billion people.
So now we have a pandemic, and health communication is really critical for people to understand what to do to protect themselves and their families. What's been CCP's role?
We were asked by USAID if we could respond quickly to the COVID-19 pandemic in March as it was emerging. And this was through our existing USAID flagship project on social behavior change called Breakthrough Action. And over probably beginning in March and over the next month or two, we ended up quickly getting involved in COVID risk communication, community engagement, and just overall COVID prevention in 22 countries around the world, from Africa to Asia to Central America, working with local government, local ministries of health, local coordinating groups to try to bring everybody together and promote a clear set of messages of COVID prevention so that all the different partners on the ground could speak with one voice.
Now, I understand you've brought 4 clips to play. Tell me about the first one.
The first one takes place in Philippines and is in Tagalog, the local language there. And it's called Bida Solucion, and it plays off the idea of superheroes and being a hero. And everybody can be the hero and be the solution to prevent COVID.
Paano ba maging bida sa panahon ngayon kung ang kontrabidang dapat talunin ay COVID-19? Ganito ang Bida Solusyon!
B. Bawal walang mask.
Ay, isanitize sa mga kamay. Iwas hawak sa mga bagay.
Bida Solusyon sa COVID-19!
Wow, you really get excited listening to that one.
Yeah, I think you can hear the classical superpowers sort of whooshing off the comic book page and bringing you the power to wear your mask, keep distance, wash your hands, and that everybody can be that hero. Everybody has that superpower.
That's great. What about the second clip? Where are we going for that one?
So we're going to go from Asia, the Philippines, over to Ethiopia. This was one of the very first COVID prevention spots under Breakthrough Action. And this radio clip was also in TV spots as well as billboard. It's a conversation between 2 men and 2 women. And they talk about how it's really an individual responsibility to take care of all of our family members around them, be their fathers, mothers, brothers, and sisters, that there's no cure and we have to be vigilant. And it's up to each one of us to wear a mask. And that's how you protect the people you love, by wearing a mask and keeping your distance.
Great, let's listen.
ሰላም ጤና ይስጥልኝ።
የኮሮና ቫይረስ በሽታ በሀገራችን በፍጥነት እየተስፋፋ ነው።
በርካታ ሰዎች በዚህ በሽታ ህይወታቸው አልፏል፣ እያለፈም ይገኛል።
አባቶቻችን፣ እናቶቻችን፣ ወንድም እህቶቻችን በበሽታው ይሰቃያሉ።
Well, it's powerful how the various actors in this spot are talking about the coronavirus. I'm looking at the translation here, and they're saying things like, we must especially be ever vigilant to take care of our loved ones who may get gravely ill because of this disease. And then someone else says, I, for one, will not be a reason for anyone to get sick.
Yeah, I think in this spot, the conversation between the two men and the two women really hones in on the individual responsibility, not only to themselves, but really to their families around them, and how it really appeals to everyone's sense of caring for their loved ones to do the right thing and wear the mask, which this focuses on, especially mask wearing. And really, I think the seriousness of the tone really emphasizes the seriousness of COVID, which I think took many people by surprise. It's not just a cold, but in fact a very serious disease, and thus their tone is very serious in wanting to combat it.
I mean, it's interesting just to hear the contrast to the spot that we played from the Philippines, where the tone is still very serious, but also a little bit playful with the superhero theme.
Yeah, I think the superheroes theme is playful, and I think it's perhaps more emotive, and people in the Philippines respond to that kind of dramatic call to action. And when it was pre-tested, they liked being compared to the superheroes, which are very popular in the Philippines.
Now, this next spot is from Nigeria.
It's in Yoruba language for the Yoruba ethnic group. And this spot takes place in a barbershop, which is a very popular place for people to get together. And barbers are trusted sources of information, as well as other customers in the barbershop. But here a customer comes in and starts talking about he's heard that there's there's a certain alcohol that kills coronavirus. And another customer says, well, no, that's not accurate. That's not how you prevent the virus, and that you have to really squash the rumors, and you can't create panic. The only trusted source of information is from the Ministry of Health, as well as the Nigerian CDC. So it's a nice conversation, almost like a peer assist, where among a group of friends and the barber, they're correcting each other and setting each other straight on how to prevent COVID.
Nínú ilé ìgẹrun tèmi yìí pẹ̀lú àrùn kòrónà bí kí náà ti ń pè tó ń tàn káàkiri yìí mò ń ṣe ìmọ́tótó tó yẹ gan-an ni.
Ó dà bẹ́ẹ̀.
Ẹ dákun ẹ má bínú, ẹ jẹ́ sáré yẹ mẹ́sẹ̀jì tó wọlé wò. Àpò oríire o, àwọn ọ̀rẹ́ mi sọ pé wọ́n ti rí ọtí líle kan tó dájú fún àrùn kòrónà.
Àti ọ̀dọ̀ àjọ Federal Ministry of Health.
Ojúṣe gbogbo wa ní ṣe fún.
So you really hear the customer come in and say, hold on a second. You really have to listen to the Nigerian health authorities before you believe something like that.
Yeah, and it's very animated, and you can tell they're very comfortable exchanging information and one correcting the other. And it ends with the wonderful Nigerian music.
Great. Now, our fourth and final clip comes from Guatemala. How would you introduce this one?
Well, this was really one of the first spots that we developed in Guatemala. And it was in a period of sort of varying and increasing lockdown. And the spot talks about if you have to go out for an errand, to the market, to school, to a job, you need to wear a mask and distance yourself and wash your hands. But there's a real emphasis on wearing your mask. And it says, Corona does not pardon. And that really plays off the Catholic culture of Guatemala. It's also done, we're going to hear the one in Spanish, but this spot is also done in a number of multiple indigenous languages.
El COVID sigue aquí. Cuando haces una visita, sales a hacer un mandado, vas al trabajo o te quitas la mascarilla para comer. Cuidarse es responsabilidad de toda la familia. Usa tu mascarilla, mantén tu distancia y lava tus manos. Si te proteges, también proteges a tu familia.
At the end of the Guatemala spot, it emphasizes that when you protect yourself, you protect everybody. So it's everybody's responsibility to protect the family.
That seems like a bit of a theme, but definitely we heard that in the Ethiopian selection.
Definitely.
So how do you go about working with your partners in these countries to decide what approach to take for messaging on COVID?
In each country, I think it's a little bit different, but usually we work with the RCCE group, the Risk Communication Community Engagement Group, and we try to do some quick research via phone or sometimes via social media or WhatsApp to find out what people know, what they don't know very well, what they're afraid of. And we try to frame the 4 main prevention messages really hitting home on what will resonate best with the local audience.
And do you do any testing of the messages before you go national with a spot?
Oh, yes, absolutely. And I think, it was difficult to do formative audience research as well as message pretesting because of the curfews, lockdowns, or general, wide distancing. But we got pretty creative, and in different countries, they used Facebook Live, they used social media, they used telephone, they used WhatsApp to pretest the messages. And it's great because until you get some preliminary audience reaction, you don't know if you're articulating what you want to in a way that the audience can understand it and take action on that message.
Got it. And then afterwards, how do you know whether these messages have the desired effect?
We're always trying to figure that out. And again, that's even harder in COVID. The first thing you want to do is make sure that you've gotten a wide reach, that your audience is hearing what you're saying. And so you do that through different monitoring of different media outlets and how many times your message has been broadcast and the approximate audience of that media outlet. But then we've also tried to do follow-up surveys, again, through telephone, through WhatsApp, through GeoPoll, to understand what action people took as a result of hearing a message. And the action can be anything from discussing it with a family to a neighbor and specific actions they might have taken. For instance, washing their hands more times a day, making sure they had hand sanitizer, making sure everyone in the family had a mask and used it all the time.
Well, in order to get that kind of change, you really need to play these quite a lot. Is that what's happening?
You do, and again, that it varies. When I think COVID started, I think most people in the world thought it might be a quick epidemic, and we quickly got out information in many countries, and then COVID has just continued. So we have continued to broadcast messages. And as time has gone on, not only the 4 main prevention messages, but really trying to dig in to understand the prevalent rumors and really combat those rumors. So, yes, and we use all sorts of different approaches. Radio, TV, billboards, social media has a very wide reach. And you can be very agile in social media with changing your message frequently and adapting it.
Well, thank you so much for walking us through this work and just the immense amount of effort that's going into helping people in every corner of the globe stay safe.
Thank you, Josh.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.